Hello, everyone. Welcome. Thank you for joining so much. My name is Maritsa Barros. I'm here as your host for the Island Pulse podcast. Thank you so much. We're so excited to be here today having a discussion with Dr. Veronica Maria Pimentel. Mfraldred.
See,
She's giving me the nod, y'all. She's giving me the nod. I'm so excited to be here to talk to her today about bridging heritage and health, so our culture and our wellness. We're going to be discussing holistic care, mental wellness, and Cape Verdean empowerment. So, welcome. Thank you so much for being here. I want to offer a short welcome as we start this conversation where we're going to explore the power of heritage, healing, and holistic wellness. Just taking the lead, right? Daring to lead in our own wellness and healing process. Not just in Cabo Verde, but throughout the diaspora. We know this podcast is being produced here in the United States, but we're trying to obviously connect with Cape Verdeans around the world. Today's episode is gonna, again, like I said, be focused on the intersections of medicine, identity, and empowerment. There's no better person to have this conversation with, y'all, than the guest I have here with us today. Her work speaks for generations, right? She is a maternal fetal medicine specialist and also an associate professor of OBGYN. So she is in practice, she is in the classroom, total powerhouse. I'm super excited. It's my first time meeting Veru. She prefers to go by Veru, so I'm gonna call her that. I've read a lot about what she has to offer, and her ability to speak intergenerationally is what excites me most. So let me tell you a little bit about her. She led the charge to honor the enslaved Black women exploited by gynecology. She advocated for Connecticut's extended postpartum Medicaid coverage, which passed. So kudos for that. She is a host on her podcast, The Labor of Love. She is one of the founding um, members of the Cape Verdean American Medical Society, which, of course, is our platform host, y'all. So, how exciting! She is a mother, and with her children, they authored a book. It's called Growing Multilingual 60 Words in English, Francés, Espanol, Portuguese, and Criollo. Sheesh. So she is bold, she is brilliant, and unapologetically committed to bridging ancestral wisdom with modern care. Y'all, please help me welcome Dr. Pimentel.
thank you so much, Dr. Barros, Maritza, for this warm introduction. I am so honored to be here today. First of all, thank you for choosing me as your first guest. Yay! This is
Yes.
definitely an inflection point. This is something we're gonna
Yes.
remember. So thank you. And I love the name of the podcast, Island Pulse.
Mm-hmm.
Because it just reminds me of rhythm and heartbeat and life. So thank you so much.
Yes,
I
and we're trying to connect. You gave me chills just in saying that because we're Januspaja Paturu Mundu, right? As that song goes, Oja undi ki jadu anda. But we have to remain connected, right? So I'm excited for you to help connect us to modern health, talking about healing and self care. And I know that obviously medicine is part of that, but there's a lot of power in how we care for ourselves daily as well. But before we dive into that, tell me a little bit. Just tell us like where you're located right now. And I was hoping you could share a word or a value from the culture that grounds your work.
So I'm in the good old state of Connecticut, which is home for me. I grew up in Waterbury, Connecticut, which has
Mm-hmm.
one of the long-standing communities from majority from San Nicolau, where I'm originally from. So I'm from
Okay.
Stangia. For those of you who are from San Nicolau,
Yeah.
for those of you who are from outside San Nicolau, it's called Ribeira Brava. And but then I came to the US when I was 14 and I grew up in Waterbury. So I'm back. I've been
Mm-hmm.
back in Connecticut after doing my residency in Boston. So I was in
Wow.
the middle of a lot of people from Fogo and from Praia when I was
Praia.
in the Boston Medical Center. And then I did my fellowship in New York and I came back home where I've been for almost 8 years. So
Wow.
excited to be raising my kids near the community. And I would say if I had to choose a word, it's so hard. I'm Cape Verdean. We talk a lot, right? So, but if I had to choose a word, it has to be esperanza or hope.
Mm, mm,
That's what keeps us going. Um, and, especially when things are so rough and
mm.
tough, it is good to have hope in your heart and to try to make tomorrow a better day.
Yeah, definitely. And I can see how that keeps you grounded, especially working in the medical field in the United States,
Yeah,
right?
indeed.
So I'm so excited to get into this conversation. Your journey is layered with both personal experience and public impact, and I know the listeners are gonna go away inspired and informed. So let's get started.
Of course.
All right, cool. Let's start with talking about integrative care. Many of our communities rely on traditional remedies. I know every time I get sick, somebody's telling me about some type of shot or something that I have to do to get better. Um, but also modern care, right? Obviously, going to see your doctor and things of that sort. How do you advise patients to integrate both without conflict and considering, especially I think today and age where we're trying to think about more about holistic approaches to medicine versus just like responding with medicine.
No, I hear you. It's definitely an interesting question and a complex one, if I may add. But I'm going to
Hmm.
try to answer it as succinct as I can possibly do that. I would say that a big part of my job is talking to patients and really looking at what I describe as risks, benefits, and alternatives to whatever
Mm,
it is that we're talking about. It could be a
gotcha.
procedure, it could be a medication, it could be something that you're going to do, including flying for vacation while pregnant, right? So
Right.
we're always talking about those things, and there's always an alternative, but the alternative is not always a good option or as good as an option. And
Hmm.
part of my job too is going into the data as much as we have data in pregnancy to say, hey, this is what we know about, the potential benefits and the potential harm. And I think a lot of times people are a little bit wary of medication because it's medication. But the fact is that the medications that we prescribe our patients who are pregnant, we know a lot more about those medications than we know about something that they may buy at the farmer's market or some other place, right? It doesn't mean
Hmm.
those things are harmful, but those things haven't been studied. So just because something is natural doesn't mean necessarily that it is harmless. And it may be
Right.
harmless if you're not pregnant, and it could potentially cause some harm if you're pregnant. That said, there are a lot of wonderful things that we can do that can complement the medicine that we do. Because
Mm,
I'm a person of faith, and I believe that faith takes us very far as well, right? So,
right.
if one of the most potentially detrimental things in pregnancy or in life is stress. So, if
Right.
you have things
Right.
that you can do to take away your stress, if it is at night drinking a nice cup of tea and having 5 minutes for yourself, do that. Okay.
Right.
If it's prayers, praying, do that. Meditation, whatever it is, do it. I grew up in San Nicolau where we did have a medicine man. We had a medicine man that we went to go see that would chop corp. I don't know how to say that in the in
In
like in prayer, but basically these are massages or body movements that kind of bring your body together. Like if you have pain or
oh,
if you feel like if you just it helps you that way. Even when people break a leg, often because we didn't have physicians that available at times, he would be the one to help us with those situations. So I do feel comfortable exploring those alternative methods. I just think we need to know that sometimes they're not well studied and they could be potential poor outcomes if you do something that you don't know much about. But
yeah.
there are many wonderful things that we can do that we know will not cause harm and could very much help you feel grounded and feel
Mm-hmm.
more in control, feel more hopeful, and have um, be better present for your own health and the health of your family.
Right, right. Because in essence, by the time you get to the hospital, you're in need of care, right? You're in need of some type of response. But those day-to-day habits and practices is what I'll say matters most because it all matters, right? And it all plays its part when it's needed. So let's talk about food because we know we heard it ever since we were little. You are what you eat. And I can think about the food like dita and na Cabo Verde is natural for the most part. You're raising your own cattle and foods and for the most part, that food there is good. It's natural. But then somehow Dinamarca, it's like when we're eating the rice and the legumes and the fish and the this and the that. I get obviously you're gonna tell me about the processed foods that's combined, right, in the American food system. But we're seeing all kinds of diseases, diabetes, cancer, all types of things coming through that wasn't as normalized as it is today. How do we celebrate our cultural foods and heritage, right? While addressing the modern challenges that are showing up in our health?
Maritza, I'll go back by making, if you allow me, please, just a small little correction. When you
Please.
say Cape Verdean food is natural and good, indeed it is and it can be.
It
But there
can
has
be.
been many changes in Cape Verde's food, in
I
Cape
was
Verde,
thinking that as I said
okay?
that. Yeah.
And I will give you an example. Um, I had the honor of going with the CVAMS to a mission. We went to San Nicolau, and I
Mm-hmm.
saw a young lady who happened to be somebody who her profession is to sell fish. And growing
Mm-hmm.
up, some of the strongest women I knew were women who sold fish because they would be walking up and down with that balai of fish, and they
Yeah.
were strong.
She-
Like I looked at them, I'm like, wow, right? Like as a
Yeah.
child, they seemed like towering of women. And so I met this young woman, and she's complaining of pelvic pain. Long story short, after I do an exam, do an ultrasound, and talk to her, and so on and so forth, I realized that the cause of her pelvic pain is constipation. It has nothing to do with her feminine organs, right? And
Mm.
then I start going into diet and hydration. And she told me, I was like, so I asked her, what do you eat? She told me, só coisa sap. And I was like, okay, what's coisa sap?
So, right.
Okay, right? It was hamburger, uh, potatoes, like fried French fries, all processed food, which costs money. And to her, those were good things because those were things from abroad. And if she's gonna eat those things because they're good stuff. And she told
Yeah.
me, minha peixeira, mas mim canta comer peixe. I
Mm.
don't. And I'm like, oh my goodness. Do you know how much those fish cost in the US? And we're like, what I would give to have the quality
That
that quality
fresh.
of fish every single day. So we had
Right.
to have a conversation about, processed food and natural food. So sometimes because of you know, impact of what's coming from abroad and this idea that aquele que é estrangeiro é direito, right?
Mm-hmm.
We like
Mm-hmm.
a lot of the diet has changed, and it shows up in increased risk, having constipation, increased risk for colon cancer, diabetes, high blood pressure. All those things can go up. And I'll tell you that the things that are killing our people, for the most part, is high blood pressure and the consequences of cardiovascular disease, right?
Mm.
So some of those good traditions that we had home where we cook the food from scratch is the best thing,
Yeah.
because we know what we're putting into our food, and it brings the family together. There's that element of bringing the family together. We're teaching our kids how to cook, which is invaluable. There's that connection there, and we're eating good food. Now, trust me, I don't really cook Cape Verdean food for the most part because, number one, I didn't learn to make it that well. Number two, I really don't have the time. But thank God for my sister and my friends. I do go and eat with them, and I do make my own version of that. But the point is, we don't have a lot of time nowadays, but it is good to try as much as possible and incorporate some of those ideas. So even though I don't always cook pure Cape Verdean food,
Mm-hmm.
what I've learned about from the Cape Verdean diet, having natural food, unprocessed, and low in salt, which I didn't learn from Cape Verde itself, but I learned it because I had a condition in Cape Verde that led me to eat low salt, and that's how I learned to eat low salt. I incorporate those into my diet. So in pregnancy, part of my discussion with my patients is about diet because it's so important in pregnancy, getting that good nutrition and trying to prevent gestational diabetes, trying to prevent excessive weight gain, all these things that can be bad in pregnancy. So I do have a lot of discussions about nutrition and exercise as well,
Mm-hmm.
because
So,
they go hand in hand.
because they go hand in hand. And that's what
Yes.
I was going to lead to next is so, okay, as long as we're raising and farming, right? If we're raising our own foods and we're cooking, like I notice when I go to Cabo Verde, the seasoning, like my seasoning, like in my pantry where I have my seasoning versus like the seasonings they use in a Cabo Verde is totally different. They're just like straight aju, sabala, and it tastes amazing. But even
Hmm.
when we come try to do that here, it's not getting the same flavors. But that, of course, we know it's because it's the difference in growing. What are some of the activities though, right, that we should be doing to promote especially I'm coming from the perspective D Marca, so maybe you can think about the different diasporas. We're not going to catch them all, but how do you maintain that balance when you live in such a high processed
Environment, right?
environment?
Yeah. So again, I'm also not a gardener, but every summer I have two little plots where I make a point of my kids growing a garden. You know,
Yeah,
now it's not going to sustain us for much of the year, but it's the point of teaching kids
right.
to grow and to honor, um, what we're able to cultivate and the importance of um, natural
Mm,
products, right? And that's an exercise in and of itself. Gardening is a great meditative and it's a great even physical exercise right there.
perfect. That's right there. Yeah.
So if you have a little, you don't have to have much of a plot. I mean, I lived in New York and people used to have little gardens on their windowsill. So you can be
Yeah.
creative about what to do. If you
There
want
you
to
go.
have fresh condiments, right? You can grow little plants with sage, with basil, with whatever it is that you need right on your countertop with just a little bit of dirt and maybe, a little can, right?
Mm-hmm.
But I also think about for me is what motivates me, what motivates my family, because that's who I know the most, is
Right.
the things that almost are fun. We are a fun people, Cape Verdean people. What do we like to do? We love to dance. So
Yep.
let's dance, right? Let's dance. I remember like when I came to the US, I would go to the Cape Verdean Social Club in Waterbury every weekend. We would dance for 3 to 4 hours. I mean, that's quite a marathon right there every single weekend,
You see that,
right?
y'all? Those of y'all
So,
who are partying every weekend, you working out.
yes, but I wasn't drinking alcohol, which can be
Hey,
like, right? So,
drink
so
that
be careful.
water when you work out.
Be careful with that. But the dancing is amazing. Think about how
That's a
many
good
people they,
point.
they do like Zumba, salsa classes. I mean, we
Yes.
have amazing dances. Like, think of like I wish I could learn to dance ciabatta as opposed to faking it. That's quite a cardio right there.
Yeah,
Funana,
yeah.
coladera. All of these things are we're having fun and you're exercising.
Yep.
I also love nature. I grew up in Sunny Cloud. Sunny Cloud is a valley. Ribeira
Yes.
Brava in particular. So I was used to going up and down the mountain. That was normal for me. So now what I do is I go hiking.
Go
That's
hiking.
right. So
Yes.
hiking doesn't have to be just for white people, y'all. We grew up hiking. This is what we did in Cape Verde. That was part of our life. We
There's
hiked for
a
a
lot
living.
of things that we've done before that we associate to white people and white culture, and it's not. The origins is actually from us.
Right? So
Yeah.
let's do it for fun. Like you go into
Yeah.
the woods, it's so beneficial to you and the exercise of that. And then honestly, if there are other things for me, I found that one of the best stress reducing things for me so I can kind of clear my mind and be ready is actually going to the gym. And I do love
Yes.
it. It's the gym for me, it's I don't go to the fanciest gym. I go to the
Mm-hmm.
gym across from the hospital. I look at convenience. And what I love about that, and there's something that I had not yet verbalized probably until today, is that
Mm-hmm.
something about it reminds me of Cape Verde. And the
Mm.
reason being is because the people that go there is a small group of people. Besides the silver sneakers, there are a lot of silver sneakers or elderly people that go to exercise.
Got
But the
you.
younger people, they're from all walks of life. Like I'm a physician, and one of my good friends there is a medical assistant. Then you
Mm-hmm.
have X-ray techs. Then you have this, so all like different professions, most of them medical, but um, different professions
Areas.
into medicine, different areas exactly.
Mm-hmm.
And we talk. It doesn't matter. We talk, and we're there, and we form a community. And when one person doesn't show up, we're like, "Hey, are you okay?" You check on that person to make sure that they're okay. And that also is good for your mental health and
It
good
is.
for your well-being. Okay?
It
So,
does. So tell me, so you talked about good eating, eating well, working out, you just mentioned. Talk to me about the other parts of holistic wellness that should be part of our daily practice
you
for
know, it, it
longevity.
it's individualized. I think generally speaking, Cape Verdeans are people of faith, and generally speaking, we are Christians. And I think there's a lot of validity to going to church. I go to church, I attend the church fairly regularly. And I've always liked it because since I was a little girl, I was never forced to go. I've liked it because I go there and I do my own meditation. It's time to stop. It's time to just, clear my mind. Um, and I do it even when I haven't had a community inside the church. Now I've been able to develop a good community in the church, which then has added benefits, right? And going there also may allow you to do community service. Like when you do service, work in service of others, you really feel good about yourself. It really makes, it helps your mental health as well. So, and that's one thing I recommend. And often people tend to do it in relation to their church. You could
Mm-hmm.
do it through other organizations as well. Um, so that's another practice that I think it's important. And listen, let's borrow from other cultures if it helps us. Let's meditate if it helps us,
And this is
for
what I
example.
wanted to ask you actually, because that's what I was thinking about is that spiritual practice and the benefits for self-awareness, right? And self-actualization. Where culturally, Cabo Verde, where does that religion, spirituality, any of those practices, how does that show up historically or versus modern times today from your experience?
Yeah. I mean, I can speak from the experience of Sao Nicolau and
Mm-hmm.
also from perhaps a little bit more individualized because my father passed away when I was very young. And one of the
Mm-hmm.
experience I've had is that we spoke to the dead. It sounds
Mm-hmm.
weird to say that, and I tell my friends who are American that if somebody were to do a psychological exam on my mother, they probably would have labeled her something, given her some sort of diagnosis because she spoke to our ancestors, meaning she would pray to them, she would ask for guidance, or if things were hard, she would be like, "Oh my God, help me, guide me. You're my you're my guardian angel now." And so I grew up with that feeling that even though my father had passed away or my grandmother had passed away, they were part of our family and they were there to
Mm-hmm.
guide us, right? They weren't
Mm-hmm.
physically there, but they were spiritually there. You felt connected to your ancestors.
Yeah.
Um, I didn't grow up with any practices of truly speaking to the spirits. I know that there is racionalismo cristão, for example, and it's present in San Nicolau and present in San Vicente at least. And I know the other like curanderia type of practices. I'm not as familiar with those to be honest, so I can't speak about that. But there's
Right.
definitely Cape Verde's Christianity is not the Christianity or even Cape Verde's Catholicism, which is what I grew up with, right? It's not
Mm-hmm.
exactly the same Catholicism as the American Catholicism. There is if you really look into it, there are a lot of infusions of sort of perhaps African values or African understanding of
Mm-hmm.
things that don't exist here in the US. And there's an island spirit to that Catholicism that I think is different from the American Catholicism.
Oh, I really appreciate you saying that as someone who was born here in America, because that cultural knowledge is not translating from the islands as we trans. I don't know if they're taking it to other diasporas, but here in the US, there's a major disconnect, right? It's like straight religion when it comes to spirituality, but the spirituality that you're speaking of in ancient connections to African traditions really helps ground us in ourselves, in the power within that we have as human beings that I feel like obviously intentionally was um extracted right from our teaching in the US. So that's interesting.
Yeah, so I don't have that experience because I came from Cape Verde, but I
Yep.
do have to say that it was very difficult for me to find a church that I connected with because I couldn't find
Because
a church that I felt
yeah.
um understood my spirit, or I understood
Yes.
the spirit of that church, right? Because I'll give you just a brief example in São Nicolau, where like we have Carnaval, right? Carnaval is huge in São Nicolau. So, that we would make the andor, the floats in the seminary that belong to the Catholic Church. And we
Mm-hmm.
would have a dance parties for Carnival in the seminary. And the attire for Carnival is
Carnaval.
it's a
Yeah.
little revealing, sexy, and people are having fun. People may be drinking, all that kind of stuff.
Yeah.
Okay, but then but the church supported that party with the people because it made us happy and it
Was a
was part of our
celebration.
culture. And
Yeah.
then comes Quarta-feira de Cinza, the party ends and you go to church. There's no like, it's not like you have to be either a party person or a church person. You can be
Yeah.
both. You can celebrate the
Yes.
different parts of you. And that's what I loved about growing up is that you don't have to be just one thing. You could have multifaceted. You could be multifaceted and embrace all these different parts of your culture and be okay with it. And they lived in harmony, you know?
Yes, yes. So we've discussed the nutrition, what we're eating, the physical, the spiritual. What's missing is the mental health, right? I know it's embedded in there. What do you have to offer us around mental health? We know it's a big topic. It's a lot of people trying to break the stigma. And there's a lot of gurus who tell you about, the morning routines, for mental wellness and whatnot. Do you have any secrets or practices that you do that you might want to share? Especially for people who I think, again, we're in a society speaking from the American perspective where it's more about what we're putting out than what we're sort of like giving within.
Yeah,
Um, Nunca tem tempo. Porque esse que tem tempo, man, has to take care of ourselves and our mental health. Any
yeah.
tips?
I mean, it's definitely hard when people say que tem tempo. I get it. I don't have time either. There's
Right,
10,000 things to be done. But I do feel like when it becomes part of our lives and we integrate it in a way that it's just life, then it doesn't feel like work. So there's definitely mental health disorders, and we can talk about that. And then there's like the sort of overall just self-care that
right.
may prevent some potential mental health disorders, at least when you take care of yourself in combination to getting the other help for mental health disorders, then you can feel better. So there are things that we do as a community, technically, most of the time that is really good. We talked about, you know, having these social clubs where we go, the Cape Verdean social clubs or different organizations, our Cape Verdean organizations, and forming a community. That's very important. The dancing, maybe working out, we talked about that. Honestly, doing our hair. Okay, don't I went to the hairdresser for the very second time since the pandemic yesterday. Okay, I am terrible at this because I have learned to take care of my hair myself. I don't do a great job, but I should be going to the hairdresser. I went yesterday and I was like, wow, it's been a while and it's so
It
great. I
feels so
remember when
good.
I used to come every 2 weeks and it
Yeah.
felt amazing, right? So it's my struggle that I'm going to have to make time for that. So that's one level is sort of self care, realizing that. in order to take care of your family, you have to take care of yourself first. We
Mm-hmm.
all use this analogy on the plane that if like air pressure drops, you should put your own mask first before you put
Right.
the mask to somebody else. So if your cup is empty, you don't have much to give. And
Right.
that's a lesson that I've had that I've learned over and over again, which is why I'm making the time to exercise very regularly, where I could be doing a number of other things, right?
Yes.
So, taking care of yourself, self-care is very important. At the end of the day, that's not always enough. Mental health is as important as physical health. So, I don't
Exactly.
want to throw a lot of statistics, but I will tell you that, 1 out of 4 women experience some sort of mental health disorders in the United States, right? And um, sometimes the stresses of like either adjusting to a new culture, the stresses of a job that might not be secure, the stresses of racism, okay, the
Right.
stress of xenophobia, the stresses right now of not knowing who they're going to grab and send back home.
Mm-hmm.
I mean, this is trauma. It could be little trauma, but sometimes it's big trauma. Little trauma that accumulates or big trauma that comes at once. Those do impact us. So there are times we need to talk to a professional. Okay. Now, it's expensive and it can be hard to find a good one. I admit that, right?
And one from your culture or that understands your
Your
culture.
unique circumstances,
Yeah.
including like, yeah, that could be some culture congruency, meaning, right, again, similar culture. But let's not be afraid of that because sometimes people think, minka está doido? Minka doido? Por que você está a falar com alguém? By the way, my Badu is very bad. So, yeah.
It's okay. I'm from
Eh,
Fogo and I mix it all up, so it's okay.
ok. Mas a gente falando assim, claro, nunca tá doido, nunca está doido, nunca tá bem, nunca tá doido. But you're not crazy. It's not about being crazy. You know what? Often we have good friends that we talk to in our culture, and it can substitute. Like you may not need therapy to the extent that maybe quote unquote your American friends need it because maybe you have good community support, but it may not be enough. And
Yeah.
if someone recommends that you seek mental health therapy, give it a try. Go there with an honest heart and give it a try. Um, and some people do need medication. It may not be forever, maybe temporary, but some people need medication. And then there are some people that truly do need medication, and that's beyond the scope of my scope of expertise. But all I
Yeah.
can say is if we have diabetes and we need insulin, we should take it. If we have high blood pressure, we should take our medication. If we have serious depression and we need medication, we should take it. That's sad. I will tell you that we come from a culture. I see many people walking around with blood pressures in the 180s, 200s, and not taking their high blood pressure medication. So, um, we're not always good at taking the medication, even for physical conditions. So, and
Yeah.
mental health can become a little more difficult.
Yes, yes, and I'm here wondering where I'm gonna go next because so many questions circling my mind. The piece about let me just back up for a couple things that you said about mental health, and then we can move on from there. Um, when you talk about the culture and our ability to communicate, we have very supportive, for sure. However, the effective communication when things are hard, I always share in some spaces, how for very long time I didn't have the ability to name my feelings because growing up culturally, nobody really gave attention to the feelings, and especially as a kid, it's like "Basintala," you know what I'm saying? But
Hmm.
um, being able to name feelings or name conditions or I guess it is your thoughts and your feelings. Just being able to give name to it is really helpful to getting to the healing part, right? So in that part about the therapy piece, like if you're not able to even be aware and name your feelings, that's one major benefit because if you can name it, you're aware of it, then you can start working towards healing and changing it. The other piece was about the mind. The same way like we feed our bodies, Are there things you do first thing in the morning? Like I think about Mel Robbins, who talks about the 5 second rule and tells you to put your phone in the bathroom so that you can get up immediately. And then, as I've been in my own spiritual investigations, if you will, pouring into your mind good things, empowering things, things that affirm you before you get to the scrolling, before you get to like the mental comparisons of other people's lives and how horrible, and then that this is the state you're waking up in. Is there a practice that you have that helps combat that like first entry into your mind and how that fills your spirit or not for the day?
Yeah, so I have to be honest that my practice changes from time to time, and that's because I'm a avid reader, or I should say listener, because I do mostly
Yeah,
listen to books nowadays than read.
same.
And I love all these books about a lot of self-help books.
Yeah,
Um, so if I they mention something that's useful, I try it, and it may be I may sustain it for a while. Sometimes it will change. But one of the things that
I
I
love that.
I go back to over and over again is really prayer, because that's what I did growing up. You went to bed,
Mm,
you said a prayer. You got up, you said a prayer.
that's right.
And I also try to just briefly think about in the morning what I want my day to be like.
Setting intentions,
Yeah,
y'all.
sometimes is a list. Sometimes I'm making a list about like I gotta, find daycare for or find, like right now, summer camp for my child. I have to make sure that they go get their vaccines and go eye exam. Sometimes it's a list of things, but even that list keeps me organized.
Yeah.
Other times it's just saying, hey, I think I'm gonna have a potentially rough day. So how am I gonna deal with that? And just have that mental conversation. Um,
Mm,
and for me, actually, the most important part for me is actually bedtime, to be honest. Because
mm,
when I go to bed, I don't want to have any rough conversations before I go to bed. I don't want to have any stressful conversations. I don't want to think about the 10,000 things that I have to do tomorrow. I try to get my mind off those things for a good half hour before I go to bed. And
mm-hmm.
because I grew up listening to stories, like before bedtime, nobody read a book to me. They actually told me stories. Would sit there, they would tell you stories, and then you would go to bed. So I like this idea of somebody telling me a story. So
Yeah.
I will listen I'll put my phone um next to me, this which is bad, but I will turn it down because of the light, and I'll put
Mm-hmm.
like a show that is mindless, something that is just for fun, and
Yeah.
within 5 minutes, I'm asleep because it's somebody. I imagine my mom telling me a story and putting me to bed, and I really love that visual. And the other thing is, I already have done that for my kids, right? I already
Mm-hmm.
have read a book to my kids, put them to bed, and realizing how blessed I am because I prayed for those children for a long time. And no matter
Mm-hmm.
how rough my day was, I'm still blessed because I got exactly what I wanted, right? So understanding
Yes.
that, so acknowledging your blessings as we go along. So
Okay, we're gonna have
yeah.
to do a whole nother episode on putting the kids to bed part, okay? But um I love that. That is a gem, y'all. Do you hear that? Everyone talks about these morning routines, which is obviously important because when you first rise up, but are we paying attention to how we are going down, how we are laying our heads down to sleep? What are the last things we're listening to? When are we cutting off the electronics? When are we not eating anymore, right? But I also love the fluidity, like that you're allowing yourself to sort of like be moved by the things that you're learning. Just even for me, that was helpful in the moment, to be honest with you, because I've been trying to find that perfect routine, and it's obviously nothing is perfect. But that permission to, you can switch it up sometimes, and that's okay. I really appreciate that. I
And you
love
should, right? I mean, like, none of us can be that consistent every single time. And you grow. Maybe what worked for you 5 years
before,
ago doesn't work
right?
right now. So I think we do have to change. And we also I like this idea of giving ourselves grace to
Yes,
understand that we're not going to be perfect. That may include, like, oh, I'm going to exercise every day. And you realize that, ooh, a week has gone by, you haven't done it. Okay, reset. Have
yes.
a new intention. Don't wait until the New Year's. like
Right.
new intention for next week or for today. So I try to do that often, and I think
Yeah.
that's something that has kept me going, kept me sane, doing
Yes.
very, very interesting times. Let's put it that way.
Yes. Yes. No, I super appreciate that because I can resonate with that right now in real time. Let's talk about medicine because I feel like, my parents are in their elder years and I'm seeing all the medicines that have to be taken here. Remédios de tio que nos pais se tomar. And there's I think a big dependency, I don't know if it's a real thing, it's a factual thing, if it's just in our heads, but about the difference between the obviously medical care in Cape Verde versus here. But where do we find a balance? Like, because we know the Nostera, like is like that's the good stuff, the roots of, wellness. But then in America, it's like we're just like, is it because we've been told that we have to take these medicines? I understand if we have a diagnosis at this point, we've got to treat it, right? But then
Mhm.
when is too much too much?
Yeah, that's a hard question to answer. What I will tell
Yeah.
you is that, in many, many ways, we're blessed to be in the US and have access. When you go to Cape Verde and you see how people don't get to see any specialist, or many people don't get to see specialists that they need, especially in the islands, remote islands like San Nicolau and Brava. It's so hard sometimes to see someone, or if they have to travel to another island, and even if they may not have the funds, they may not, there's a lot of barriers basically. So we are blessed to have access to medication. I think, like anything else, you have to know your body as much as you can, and you also have to be a smart consumer. Now, let's be honest, you're never going to know about that disease or that medication as much as your doctor does, right?
Right.
But you can still read about it. You can still ask good questions to figure out if it's necessary. And you can
So
also do a
true.
lot of preventative care. The thing about it is that we sometimes buy into this idea that one pill is going to solve all our problems, and it's
Mm-hmm.
not. Nothing beats the things we talk about: exercise, healthy diet, connection, staying healthy. But those things may not keep cancer away, and
Yep.
you may still need chemotherapy. You may still need surgery. And thank God that we have access to those things, right?
That's right.
So often somebody could have passed away in Cape Verde with an AVC, with, uh, now I can't even think of the word in English, but basically have a stroke. That is,
Yeah.
somebody could have had a stroke in Cape Verde and died, which happened when we were in San Nicolau. A person I grew up around who was like a young man when I was very young, and now he had a stroke and was evacuated, and he died the next day, I believe, when he got to the other island. And he was young. While here in the U.S., our lives can be prolonged, but it's prolonged with medications, it's prolonged with multiple hospital visits, it's prolonged with multiple visits to the doctor. So the best thing we can do, y'all, is do the best that we can to take care of ourselves and still go to the doctor. And sometimes we still need medication, but we're going to do our best to take care of ourselves. And then one thing, I know this is not a topic we meant to cover today, but I also think it's very important for us to start having conversations with our families about what is it that we want. What is it that we want our lives to look like? What
That's right.
happens if your heart stops? Do you want
Mm.
somebody to restart it? What happens if you have to be intubated? How do you want your old age to look like? Right? And I'll tell you that I grew up with the idea that you're supposed to die with dignity, that dying was just as important, if not more important, than being birthed.
Mm-hmm.
So, and this is a lesson I learned from my mom, because she helped many people pass in a respectful way when I was growing up, in our
Mm.
house, in her bed, in neighbors, in whatnot, right? So, and my mom being in the US, it was very important for her to tell us, look, we end up having this conversation. She said, I don't want to, if anything happens to me next time, I don't want to go to the hospital. Do not let them, jump on my chest. And I'm like, but mom, but she's like, I don't want it. And I had to realize this is her wish and I have to respect it. Right.
Mm-hmm.
So I think it's very important to have these conversations because just because your life can be extended doesn't mean it's quality.
That's
And
right.
and in order for your kids to know what you want, or for your wife or husband to know what you want, have this conversation. You're not calling in that. You're not asking death to come to you. You're just simply having an honest conversation so they can honor what you want. And I think that's super important. And I hope you talk about this in another podcast because I think this is important.
I was gonna say pause, can I? Because I hope the audience is getting this.
Mhm.
Wow, tell me what in your mind, what is the age we should start having these conversations?
I don't think there's a fast rule, but I do think that if you are a parent and you have adult kids, you should be having these conversations.
Yeah,
No,
because it
if
might be the kids who are having to sit the parents down because
yeah,
they're not communicating in that way. But that's such a critical thing because they
yeah.
count on us a lot.
And once you have kids, right, too, once you have kids, you should be thinking about, like, what do I want to do with my affairs? What happened, God forbid, if I die in a car accident? Who's going to take care of my kids? So we should be having these conversations as we go along,
Right.
and then different versions of them, because at the end of the day, we also, when we put kids in this planet, we're responsible for them. We have to think about what's going to happen if something happens to us. But then comes to an age where they might be taking care of us, then what do we want is also very important. Like some of our family members, for example, may want to be buried in Cape Verde.
Yeah,
Like maybe
for
that's what
sure.
they want. They should say that. I thought that's what my
My
mother
dad has
wanted.
made that clear.
I thought that's what my mother wanted until I
Yeah.
actually asked her, and she's like, "No, all of you guys are here. Who's going to visit me?"
Yeah.
I was like, "Oh, good point. It's
Good
very
point.
important for you to have us go visit you." And clearly in Cape Verde, we're not going that often. So it was
Yeah.
more like, so you assume some things and they're not. But the point is, have these conversations, because I will tell you, in Cape Verde, growing up, I heard people talk about death all the time. I don't. Do you know what mortaja is? I don't know. There's This is at least in San Nicolau.
Mm-mm.
Mortaja is the clothes that you pick up to be buried in.
Okay.
Okay, so I grew up with the elderly people that I know. They had picked up their clothes. They're going to be buried. Some of them
Wow.
had bought their cachon. Okay,
Yeah.
their casket, their plot. I
They're
mean, like,
very
it sounds morbid, but no, you
no, but
preparing,
my
right?
this is the tradition. They're like that. I got my spot. I don't know about you, but
Exactly. So along with that, in Cape Verde, we didn't have an option about restart my heart, or, intubate me. So we didn't used to have these conversations. But
yeah,
now we're here and the option exists. So now we have to extend that conversation to, what do I want if something happens? And I'm not an end of life specialist, but I've dealt with it enough that I
yeah.
understand the importance of it.
You've dealt with both ends of life, right?
Yes.
Wow. So I have one more question before I bring us to our flash round, where I ask you just a couple of fun questions to end us out, because I feel that okay, so I've noticed that when you go to Cabo Verde, like time slows down, right? It like goes really slow and it pauses, and you appreciate that being more present and all of that good stuff. You come to the US, it's like back to the hustle and bustle, and you've got to do this. You've got to get, the kids to school. You've got to work. You got to take care of the house. Da, 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 da. Years of doing that, and the Gwinta being a strong woman, it só crioulos, just black women in general in the US, right? Can we talk about this thing of redefining strength? Like, what is that looking like? Like, but specific to Criollo from your perspective, um, that traditional woman, I guess, and I'm saying that it's going to be based on what's familiar to you, and then the modern age woman. But how do we, like Michelle Obama says, we can do it all, just not all at the same time.
Exactly.
How can we get there though without the burnout and sort of like redefining the strength without abandoning our natural born, caring and nurturing sort of aspects as women.
Yeah. So there's such a big difference between, in many ways, being a woman, or at least even a working woman in Cape Verde and a typical working woman in the US. And both women are strong in their own ways, right? But when I was growing up in Cape Verde, at least, if you were a woman with some means and you worked outside the home, you also hired people to work at home. So you had an empregada de casa, right? Um, so you didn't necessarily prepare lunch, dinner, and breakfast and all those kind of things. That is if you had some sort of means, right? If you're a woman who didn't have any means and you stayed at home and your partner worked, then you took care of the house. Then there are definitely women who are like, oh my God, working their butt off and doing everything, because there's always that, right? In the US, no matter what social level you are, no matter your economic status, as a woman, you're working your butt off no matter what, right? You are usually working a full-time job, if sometimes not two, because I know people who are working two jobs. You are taking care of the kids for the most part. So thankfully, if you have a partner who is who helps, that's great. But still, no matter how much your male partner tends to help, they typically are not doing as much as a female partner, typically speaking. There are always exceptions, of course. Okay, so don't send me hate mail saying that you do everything for your wife, please. you know, good for you. Um, and then like you're basically working two full-time jobs, and often you're also in charge of the emotional well-being of your family, which is a third job in and itself, right? So it's a lot. And then you don't have that community that you would have had in Cape Verde. Your friends may live far away, you may not see them as often. You don't have, thank God for dishwasher um and everything, all the machinery that we have, but still somebody has to program them, somebody has to press a button, and you have to have the money to buy them. It doesn't
And you
replace.
have to put the clothes away after
You
you
have to put,
fold them.
which is the worst part. I will do laundry all day long and not put clothes away. So
Seriously.
definitely. So the point being is you don't have as much support. Like there's a saying that everywhere else, most countries have a safety net if something happens. America has women. We are the safety net. And this was demonstrated during COVID, how bad it was, how much we depended on women.
Mm-hmm.
So that's, you can possibly do it all. You're gonna break up, you're gonna break, you're gonna fall. It's
Yeah,
impossible.
it's
So for
impossible.
me at least, I had no shame. When I had my baby, I said, God has blessed me financially. I am going to find me somebody to help take care of my baby while I'm at work because I don't want to send her to daycare right now.
Mm-hmm.
And I will come home and love my baby. So I was lucky to have a nanny for 2 years when I had my baby, which was a godsend. And I was
Mm-hmm.
still 100% there for my child when I came home, and I had no shame on that. Okay, because
Yeah.
my child was safe and protected. So you buy the help that you can afford if you can afford it. If you cannot afford it, and there's programs available like state
Mm-hmm.
programs or whatever, take advantage of those. Also, hopefully you are in a relationship where the father of your children can be helpful, and sometimes you
Right.
have to guide him how to help you because some of them do not really know how to do it. Others are amazing, right? And then, listen, I moved to Connecticut for a reason. I wanted to be near my family. We don't live so close where they can be helpful 100% of the time, but they've been super helpful in being there for my kids. And now
Mm-hmm.
I have family members living with me, so I help them out, and they help me out too,
Yep.
in their own way. Um, so you just have to be willing sometimes to give up a little privacy, and I have no problem with that. That's my baby nephew, and my
Yep.
godson. So that's like a child to me. But he's in my house, but he's also amazing with my kids. Again, what did we do in Cape Verde? We grew up with family.
That's right.
My mom raised so
Above
many kids that
all.
yeah, so many kids she didn't give birth to even, right? And
Yep.
then vovô and this and the other, right? So you give that up. But that is to say it's a lot, it's a lot. So how can they expect us to do all these jobs? We didn't even do those things in Cape Verde for the most part. And now you come to the US, you're supposed to do all of that, you know?
Hey, and those of us who are born into it, we just conditioned to just either we're doing it all or we're doing nothing at all.
It's not possible. It's just
It's
not
not possible.
possible, right? We're not like we're humans, This idea, I don't like this myth of the strong black woman, honestly. I know we are strong. I know that. but it's a myth. And when it's a myth, that means that you're not expected to get help. And then you're not human.
And
And then
often
you'll feel
enough,
pain.
the one you're right, and the ones who are doing it are not in the public spaces for you to hear the stories of the supportive partner and the supportive family structure that's there to help her do it all, you know?
Exactly. And
Yeah.
it literally does take a village. Sometimes you have to buy your village a little bit if you have the means, or
Yes.
add to your village. But I'm so lucky that, that I have a partner that does a lot and is there.
Hmm.
I'm so lucky that I have family members in their own way. And I've been lucky that I've been able to also, get pay for childcare. But I'll tell you, during
Right.
the pandemic, it wasn't happening. It was like, I wanted to pull my hair in every single direction because even with money, you could not buy reliable childcare. So
Yes. And for you, of course, you're also there to serve and save lives. So we need you to be able to be at two places at one time.
now I have to admit I've been very lucky. But the other thing I did is don't do what I do necessarily, but I had to delay childbirth. I had to
Yeah.
delay because I knew that I could not be there for my kids had I had given birth during the typical time that my friends were giving birth. So that
Yes.
is a conscious decision that I
Choice.
made and a choice
Yes.
that I made, and it doesn't always work out. I'm lucky that it worked out for me, but I know I could have had kids that were about to graduate, at least graduating high school, about to graduate high school,
Same.
but
Yeah.
instead my kids are graduating from kindergarten. So
Yes. Same. Preschool.
so there you go.
Yes, all in due time. Like I think it's so true that we can't have it all at the same time, but we sure can have it all, ladies. And like you said, with the right structures and supports, the ones you put in place, the ones that are naturally there, having a great partnership, it all comes together. But I love that too that you said, working within your means, because if you don't have the means to pay for the care, but then you can seek some supports in the meantime until you're able to get to a place where you want to be. Um, and
There's no shame in asking for help. That's what
and
I say. Don't be ashamed to ask for help. If it's there, they're offering it to you, take it.
yes, because it's hard though when you come from a prideful culture and upbringing. You don't even like when you said to sometimes you have to guide your partner. If you don't have that ability to ask for help and communicate that help, it's going to be very frustrating because people can't read your minds, right?
Yeah.
So
And
that's
we
part
didn't
of that
grow up.
self-work.
Exactly. And also, let's be honest, for the most part in Cape Verde, we didn't grow up seeing this communication of people asking for help. Um,
Yeah.
like because it happened either naturally, right? And you had a whole village
You
supporting
had a
you.
community, yeah.
So it is difficult and it's something that we do have to learn. But I think this is where communication is very, very important. And then for me is, always going back to the culture, realizing that we don't have to do things exactly the same way that our parents did them or our grandparents did them, but it's in the spirit of things. What's the spirit? The spirit is for me to be there for my children and help them grow
Hmm.
and, support them and give them strong raiz, right? Because they're born
Hmm.
here, just like you, Maritza. So
Yeah.
how do I teach them to be good Cape Verdeans, even though
Yeah.
they're in the US and doing all of that? And in part this is why I even did the book with them is because I'm like they're growing up speaking all these languages. My husband
Multiple
speak
languages.
French, and I'm like I want them to learn the language because it's difficult, and I want them to know that it's important. So what are we going to do this? It's just one small step. Let's do this book. I'm tired of having 5 books and teaching you the same word from like dog here, cow over there, cachorro over there, perro over there. Like I was tired of it, right? I was like, let's put it all together
I
and
love that.
and hopefully because I know if I'm going through this, somebody else is going through this. And
Definitely.
if you allow me, let
I
me
had
just
to buy the book for my kids.
it's available on Amazon. And
I was gonna
I tell
ask.
you, we do not make we do not make much out of the book, and what we have made, we actually have donated to the Jardim Infantil in San Nicolau. We bought educational
Love that.
books, educational material that we brought to Jardim Infantil in San Nicolau, and we have donated several books to different organizations to sell and make and maybe raise some money for themselves, as well. So this, we did not do this for money because it is a little bit expensive. It's like 14.99. You think I'm making a lot of money? No, it's like $2 a book, believe it or
Yeah,
not.
but they
And
should
but
there should be a school in Cabo Verde that should be buying that book, you
you
know?
know, but we do what we it's all gone through. We want to give back. The idea
Yeah,
is, it wasn't
I
about us
love
making
that. It
money.
goes back.
We don't really make money out of it, and what we have made, we are giving back, because the idea is to find ways to to support your family in whichever way you can, and celebrate your culture, and do something that's fun. We're fun
That's
people. We love
fun.
fun, right?
And
Let's have fun.
entrepreneurial, like that's so great. We're natural creators, right? And in America, it's a lot of the messaging about consuming, consuming, wanting more and wanting it all. But we are natural creators, so that's beautiful for you to instill that in your children early. So listen, we've been having a lot of fun in our conversation, and we're gonna end on that note. So I want to hit you with a few rapid fire questions, if you'll play along with me.
I'll try.
All right, so tell me, what's a traditional remedy from childhood that you swear by?
Chá pá de tixeira.
Okay. I knew it
The-
had to be a
if
shot. I knew it.
if you had a cold, my mom would give it to us. If we had a tummy ache, my mom would give it to us. And then along with that, okay, it's Vicks. Just like
Fix.
for Latinos,
Yes.
Vicks cures everything.
Everything.
My son last night was like, Mama, can you put a little bit on my chest? I was like, Are you having your cold or coffee? He's like, No, I just want a little bit. I was like, Sure, baby, I'll do it.
That is so true. Okay, so but what's one medical myth you wish people would let go of?
Ooh. Oh my God. Oh my God. There's so many. I can't even think of one right now. Let's see. Well, I mean, I don't know if it's truly a myth, but I will tell you that you cannot always meditate or drink a shot and bring your blood pressure down. Okay, let's focus on that. You do often need medication, so do meditate, do drink your shot, but go get your medication, because that's not enough for that.
Yeah.
Okay. Um,
Meditation is preventative. It's not a reaction.
so
I love that. Yes, that okay, that does not work. That's good to know. Um, all right, what song gets you in your power zone like before a big moment? Is there a song
it all depends on the moment.
on the moment,
It
right?
depends on the moment, depends on the culture, depends who I'm surrounded by. So because again, I
Tell
am
me a
multi.
song of you going into the gym. What are you listening to?
Well, I really actually like any of the you know, Afro music because of the beats and everything else. So I would just put it on. I would just put like an Afro music station, Afro beats, and
Gotcha.
just listen to anything.
Love
But
it.
I really love my Cape Verdean song. Like you were talking about. Now I'm gonna go blank on her name. Onde a homem
Yeah,
não anda.
Suraya, kasi?
Soraya,
Yeah.
Soraya. Like I love that song. The beat of it is great. I am in love with Kalema. I could marry both of them.
Yeah,
Uh,
but you already married. It's okay.
you know, they just have beautiful voices, and they're
Yeah.
beautiful humans as well.
Humans.
You know,
Yeah.
so any like
Any one of
honestly,
those songs.
anything, like it depends where I am, and even sometimes like Santa Clau has manzurka, which is like a national, which is one of our
Mm.
island music, and they put it on, and you know what? I go straight to my system, like, let's go dance. It's me and her. She's my manzurka partner. So it all depends on the situation. I will even do country music, girl. I am an equal opportunity lover when it comes to good music.
It's all originated from our people anyhow. So that's why we feel it deeper in our soul.
Yeah.
Here's a really good one because you focus on women's health, women's medicine, and you talked about how you do a lot of listening, which I resonate with because I'm listening to something every single day. You love to do a lot of self-development stuff. What's the one book obviously your podcast. We've got to get every young woman to listen to your podcast. But what's one book that you'd gift every young woman?
Ooh. First of all, yes, my podcast, Labor of Love,
Yes.
you can find it in any of like Spotify, Apple
Streaming
Podcast.
platform.
It
Yes.
is by the American College of Obstetrician and Gynecologists, sponsored by the CDC, so you know
What?
it's legit,
It's
okay?
legit.
It's legit. I mean,
Yes.
the people that I'm talking to are the cream of the crop in our profession,
Oh, I
and they're
love that.
amazing. So definitely go and listen to that. But in terms of a book, so many. I'll tell you right now what I'm listening to right now is called
Mm-hmm.
Eve.
Mm.
Okay, it's a book that tries to explain where we come from. And this
Ooh.
person does an amazing job of even explaining some of the medical terms that we often don't like. I would have had trouble explaining honestly. So the title is Eve, and I would just really recommend listening to it. It's
Is
an
that by Kat
by Kat Bohanan, I think is
Mahan?
I don't know if
Yeah.
I'm not sure if I'm saying her name
Because I had
correct.
to look that up live while
It's
we
basically
talk.
it's Eve, how the female body drove 200 million years of human evolution. So I mean, it
Ooh,
doesn't get any more
powerful.
matriarchal than that, and
And that's
it is dense, y'all. Um, but it's worth a listening. I'm still listening to it right now, so it's a great book. Just for learning. Uh,
that's deep, deep in the roots. That's
yeah,
that's that's a good one.
my hope is one day to write a book that can resonate with women, but specifically with Cape Verdean women. But in the meantime, y'all, follow me at Instagram. I'm at drvero for moms Instagram, and I try, like I do whatever my mind thinks of. Honestly, there's no rhyme or reason for things, but I do give you good information, and I promise you, I'm going to be more focused from now on. That's one of my goals, to be more focused and more intentional about the message that I bring there. And you can send me messages there if you have questions about something specific. That you're like, hey, Dr. Pimentel, I have a question about, menstruation and whatever. And you write it down, and maybe I'll address it there. Feel free
Maybe
to
maybe
send me a
you should do
message.
we should do some lives where we could send you some questions. Tell me your Instagram handle again.
It's Dr. Vero number 4 moms. So it's supposed to be Dr. Vero for moms. So Dr.
Oh, see, I
Vero
did a wrong.
for moms.
There we go. For moms.
Yeah.
OMG. Following you.
Oh, thank
Everyone.
you.
Yes. I
Oh,
wanted
just
you to
told me
say
that
it.
you did it.
I wanted to have you say it again and spell it out slow because the people who are listening can catch you, start following you. I love that. I'm gonna start sending you questions for sure. My I have to ask you, what's your favorite dish from the culture?
One of my favorite dishes is actually shire.
Ooh.
And I love shire with, carne and a little bit of mandioca on top. And then often
Ooh.
people will have moch on the side
On the
as
side.
well. Yeah, and that's one of my favorite Cape Verdean foods that I grew up with. A
Not
little bit.
one we hear of often.
Yeah, Sunny Cloud, we like it for, especially for when we're celebrating our different saints and things. We really like that. And then on a day-to-day basis, which is Cape Verdean, but more Portuguese, I guess, I do really like an arroz bacalhau. I love it.
Ah, yeah.
But
Can't go wrong.
nothing really beats a good cachupa guisot in the
You're
morning with some
you
ostrelade and a good
you're
piece of
speaking to my
fried fish. So
you're hitting all my favorites.
that's a more everyday thing. In fact, not anymore for me. Now it's a luxury, but that was the everyday thing. And then I will add one more thing, please. Couscous quente manteiga.
I go. That's
Child,
it. We're done.
yes. So I like, as you can tell, I love food. So
You love food. Yes, good food for that. And that's food for the soul right there.
yes, yes, yes. So
Okay. So do you have a message for our audience? Anything that I didn't get to ask you that you were hoping that you can share? Like give me your mic drop moment.
oh, that's a lot of
Let's
pressure.
let's speak to the next generation, right?
You know, what I would say is have fun. Life is hard, y'all. There's a lot of things that are going to come your way. Have fun. Don't forget to dance. We are people who love to dance, and a lot of problems can be solved after you know, a good journey on the dance floor, basically.
Hmm.
But and there's and the other thing I would say is, and this is something I learned early on, there's always a third way. Often people
Mm.
say either choose A or you choose B. And if A or B doesn't work for you, find out if there is a C. Because if I had not figured out there was a C, I would not be
Hmm.
a medical doctor today, right?
Hmm.
Because we don't come from traditional backgrounds, so we have to find other ways to achieve what we want and what we need to do. And I think if you keep the hope in your heart and you work hard because we have those values and you take care of yourself, um, you know, then you could achieve a lot of what you want, if not everything you want to achieve. And be open to the universe speaking to you. You don't have to draw everything. You don't have to write everything down. Just leave room for imagination. Leave room also for new things to happen, surprises in life. Okay, because they're going to happen. My mom used to say a woman has seven luck.
Hmm.
Okay, so if something bad happens to you, guess what? You still have the ability to do more. I like to think that we have infinite luck, not just seven luck. So
Yeah,
at least she said seven, you
she
know.
got us started. Yeah.
So
I
yeah.
love that. That is beautiful. Thank you so much for that. I've
Well,
been recognizing. Go ahead.
I was just gonna say thank you. I am so excited to speak to you. This was a lot of fun. And I'm honored to be your first guest. And so yeah,
Yes.
thank you.
Thank you. Thank you for setting the bar. Thank you for reminding us that wellness isn't just a clinical outcome, right? It's a cultural reclamation. And we have to reclaim the power to take care of ourselves as well and heal ourselves. And then obviously seek medicine when necessary. And then what you just shared, there's always an alternative. So it's like breaks those limitations of where we think there's no other way. I really appreciate that. So, y'all, thank you so much. You know how to find Dr. Pimentel. And I know I said it wrong again. Tell me again.
Pimentel, like pepper.
Pimentel.
Pimentel.
I leave room for that correction because I want to
Yeah,
honor your name
that's
correctly.
okay.
So thank
Uh,
you again so much. Thank you to all the listeners. This is Island Pulse, where heritage meets healing, y'all. Catch you next time. Ciao, y'all.